nurse that will be working in the GP surgery. This is like a clinic, and they don't run night shifts in those areas, so it's like day to day business from Monday to Sunday. If it is something that you are keen about, that you are interested in, then this is actually the right place for you to be at this particular point in time. It's a band 5 role, and it is in Norfolk. Norfolk is a very beautiful part of the United Kingdom too, and the area is very cost effective, very, very lovely place to raise children, and so you are not going to regret your decisions in applying for this job, or your decisions to apply for this job. Now, you must have possibly passed your CBT and IELTS or occupational English test to be qualified for this. If you've done that and you are OSCE ready, then please waste no time in putting your application forward to this team. They are very much ready to have you, to help you, and they will support you to pass your OSCE. They will actually help you to get your certificate of sponsorship to you, help you in the process of visa applications, help you in with reimbursement of your CBT and English test fees, and they will book your flight to the United Kingdom. They will also organize airport transfer for you from the airport to wherever your accommodation will be. Furthermore, they are going to give you accommodation free for a period of time. That time was not specified, whether it's going to be a month, 6 weeks, 2 months, 3 months, or many more. So be ready to enjoy the best of the journey. Then they will support you with your OSCE training, like I mentioned before, till you've written the test, you've passed the test, you get your PIN, and then you settle in to the job. Now, what will you be doing in this place as a registered nurse working with the GP? Honestly, this is one of the very beautiful places where nurses can have life-work balance, beautiful ones. Of course, the payment might not be huge. Like if you are not working nights, all those enhancements might not be there, but it's actually not a bad area to start somebody's career. And with that, because you are not extremely high paced, you can actually study to help yourself to get yourself into better opportunities soonest. Like since you've jumped in, you can start maybe studying in some places, and you have things to boost your CV and be able to get higher band or better paid jobs. But then, even if you continue with this, there is no regret doing this kind of job. Read my lips, no regret at all. So you will be responsible for assessing the care needs of patients, and you develop plans, you implement your plans, you evaluate the programs, the care you've rendered to the patients, and how far they've been helpful. You will work in line with the institutional policy. All those policies, you get to know them on your Trust intranet, and all those things will be there by the time you get this job. You know how to go about the infection prevention control policy, the data protection policies, just name it, anything, safeguarding, mental capacity act, and all those things, patients' rights, workers' rights, and your employers' rights too. All these things you get to know, and you'll be able to work alongside every other person. Then mentorship support of new staff. When you gained your ground, you'll be able to support new staff that you were once like them at some point too, and you'll be able to mentor and support students. All these things, they will pave ways for you to be able to develop your skills and be ready to face the challenges in the business. And what are the person specification? You must be a registered nurse, and you must possibly be in the process of getting your registration in the United Kingdom. That's why they open it to internationally educated nurses. And so you must also possess diploma or degree in nursing, or be working towards getting one. That's if you are in the UK. Some people are like that. But if you are being recruited as IENS, then definitely you would have had this registration. Then desirable criteria is that you have undertaken mentorship training, or you must, when you are preparing your personal statement, just let them know that you are very much ready to undertake the mentorship training program that you will be very much ready to participate in it and perform brilliantly in it. Then your experience that will make you suitable. You must have been practicing in patient-facing units for at least 12 to 18 months. All right, if you have that, then you are good, and you must be working in the acute setting, which could be A&E. All those are our male ward, surgical ward, female ward, surgical, medical, labor rooms, postnatal room. All those places, special care baby unit, all those places are actually acute settings. And I really don't know which part of our nursing practice in Nigeria are not acute. Even if you are in the community, they will still be bringing acute cases to you. People have had accidents, you'll be doing suturings, people want to deliver, people are having prepartum hemorrhages, you'll be doing all those things. So our own style of nursing practice back at home seems to be completely acute, except in some designated areas, maybe those who are working with NGOs and they just go around giving health talks and all that. Now, or maybe those who are in the schools and they are not clinical instructors, those ones might not be able to state that they are acute nursing units nurses. So, and the skills that you must still possess too, this is essential. It is essential for you to have the ability to work in a team. Be a good team player, not someone who will be causing conflict every time, or someone when the team are going right, they are going to the left. When the team is going forward, they are moving backward. No, you must be a great team player and must have brilliant organizational and team constructing skills. You must be very adept with documentation and presentation and must be very attentive to the minutest details. Your IT skills must be there too. They are not expecting you to be IT gurus, but at least you must have those basic skills of computing, of editing, and all those things, sending mails, receiving mails, and all those things. Now, when you know that you are a sure fit for this one, then just go on ahead, read the job description, prepare your person specification, and like as I was talking, I've been mentioning those words that you can use to gain the favor of the computer algorithm that will be reading through this before it will pass through to human beings. So please kindly prepare your personal statement, because that's what is showing who you are. That is what is selling you to those people and saying you are capable, or you are more than capable, or you are the best fit for this position. Read through the job description, read through the person specification, read everything here, and then launch your application. Then keep hope alive. Thank you very much, and don't forget to subscribe. Don't forget to send this to your friends who are trying to get jobs. Thank you.